I'm always interested in looking at the baby brain. How does it develop? Because many of our babies are now being born very early in gestation, where their brain has a long way to go to reach their full developmental potential. The ultimate goal of our research project is to see whether we can use own babies' umbilical cord blood to reduce the injury due to brain injury following an intraventricular hemorrhage. Using the funding from RMM, we will characterize the stem cells that are present in the umbilical cord of these extremely preterm infants. And our hope is in future we will use the own baby's umbilical cord blood to reduce the risk of brain injury due to IVH and other causes also. Approximately 1% of all the babies are born at what we call as extremely preterm gestational age, that is below 28 weeks of gestation. And unfortunately, about 20% of them develop a bleeding within their brain soon after birth. So we call this as intraventricular hemorrhage or IVH. And IVH is a big risk factor for developing problems such as cerebral palsy and learning and memory deficits. And right now, we don't have any way to prevent IVH, nor we have any effective treatment. So we started looking, are there anything else we can do? And based on the literature in the full-term babies, we thought maybe we should try whether we can use the umbilical cord blood from these babies. But when we looked into the literature, we could not find any investigations that have done this kind of research. And one of the problems, I think, is we really don't know whether these umbilical cord blood have enough number of stem cells. And secondly, do they actually provide any neuroprotection? The grant funding from the Regenerative Medicine Minnesota is extremely important because we need to have data to see that there are adequate number of stem cells and they actually work. And this grant is also helpful in getting the preliminary data that we need for, number one, get what is called as a proof of concept, and number two, for applying for additional grant funding, because we do need to have some preliminary data to show that the cells actually work.